Welcome, everyone. We are here to discuss the concept of coaching and its use in educating nurses, both pre-licensure and novice nurses in practice. We know that the old way of teaching, where we lecture and students listen, is not an effective way to help people learn, especially in a practice discipline where critically thinking through problems is an essential skill. We are going to talk about using coaching conversations to help learners tell us what they're thinking and how they make decisions. We will explain how the NLN guided teaching thinking can be used to frame the coaching conversations. We hope to give you some ideas and examples of how you can be guides on your students' journeys to becoming expert nurses. Our presenters today are Sabrina Beroz, Teri Boese, Teresa Britt, Sandra Caballero, Dawn Ferry, and Jenny O'Rourke. And with that, I am going to turn this over to Teresa to begin the content.
Can you hear me now? Yes, okay, thank you. Yes, I made the mistake of muting myself, and then I realized that I could not be unmuted. So thank you for bearing with me. Well, thank you everyone for being able to join us today to explore how coaching can be an opportunity to help you develop skills in becoming an excellent nursing educator. So we have 5 embedded polls in the webinar today. And we would like to begin by determining first, actually, who's in our audience today. So if you can start out with us and take just a few seconds to complete the first poll. So the first question is, what best describes your current job position? So if everybody, I'll take just a second and click on that, please. Okay. Hopefully everyone can see our poll. All right, there we go. Wonderful. Thank you for your responses. It looks like we have a very wonderful representation today from many different nursing realms, especially a very large percentage for nursing education. We're very excited, and we hope that you find the next hour beneficial to your needs. We're going to move forward now and start today by reviewing the objectives of our webinar. We can move forward, please. And to begin with, we wanted to just review and let you know, we hope at the end of the session today that you will be able to, number 1, describe the importance of coaching in nursing education and nursing healthcare practice. We also hope that all participants will be able to list the key components of the coaching conversation. And lastly, we hope that at the end of the session, you'll be able to demonstrate some best practices in using the coaching strategies. We're going to move forward to, I'd like to do just a really brief pre-brief of our session to give you an idea about our proposed agenda. Today in the webinar, we're going to focus on explaining the importance of coaching and how it has an impact both in nursing education and nursing frontline practice. We wanted to talk specifically about the NLN Guide to Teaching Thinking. We're going to be showing examples of encounters with students or novice nurses. We're going to give you an opportunity to respond to these video encounters throughout the webinar. And then today we're going to wrap up our session with having a time for some discussion and try to answer some of the questions that you post for us. So today we're going to start the webinar with a very short video. My colleagues and I reviewed several videos to potentially use today before choosing this particular clip. We thought that it was very representative of situations that have occurred to us all. Whether we're in frontline education, or in frontline practice. So let me set the stage. So in the video, we want you to assume that you are the nurse. And in the video, you are actually following up on the delegation that you made, and you realize that the assistant, which in this case could also be a student nurse or possibly a novice nurse, that this person did not check the patient's blood pressure as you directed. So let's all watch together now, please.
I'm Carol. I see that Mr. Farrell's in a wheelchair and the transporter is taking him down to his chest x-ray. I thought I asked you to check his blood pressure and let me know, but I haven't heard back from you. What was his BP?
Oh, right. Well, I went into his room and he was up, walking around and feeling fine, so I'm sure his BP is okay. I just let the transporter take him, nothing to worry about.
Okay, so now we'd like to ask you just to take a few seconds and reflect on the video clip that we just saw and think about how you might respond if this happened to you today. We know that we often need resources in our roles to improve outcomes, and really that's why we're focusing today on our discussion about the coaching role. So as you're thinking and reflecting back, let's actually look at some of the words on the slide. You see many words on the slide that are utilized within the context of coaching in healthcare or coaching in healthcare education. Many of the terms are actually identifying words that are identifying the different roles of a coach, such as mentor, facilitator, teacher, educator. You also see many action verbs that describe what is done within the teaching role, such as affirming, supporting, encouraging, helping. And lastly, we also see some terms on the slide that describe the positive outcomes that can occur with coaching: success, growth, and improvement. So today, as we're moving forward, keep these words in mind as we progress through all of our different activities. I'm going to hand over the slides now to my colleague, Sandra.
Okay, can everybody hear me? Okay, so what is coaching? So we've provided 3 definitions that we felt were appropriate for the content that you will be given in this webinar. The first definition is from Whitmore, who defined coaching as unlocking a person's potential to maximize their own performance. It is helping them to learn rather than teaching them. Next is Parslow's definition, defining coaching as being directly concerned with the immediate improvement of performance and development of skills, skills by a form of tutoring or instruction. And finally, we have Downey, who states that coaching is the art of facilitating the performance, learning, and development of another. Next slide. So why is coaching important? Well, we know that coaching can lead and will continue to lead to improved patient care. And it does this by improving team and peer relationships. It gives our novice nurses the empowerment that they all seek for by providing confidence needed to speak about and describe their actions. And the way it does this is by allowing the novice nurse to acknowledge the thinking which was occurring, causing their actions. All this will have a positive impact on their professional growth and patient care delivery.
Thank you, Andrea. According to the Institute of Coaching at Harvard University and other key coaching guides, there are some basic concepts in coaching that are key to making it a successful conversation. First, coaching is most effective when the person receiving the coaching feels a sense of safety. A safe physical environment allows individuals to speak honestly and know they will be treated fairly in the coaching relationship. Once a safe physical space has been created, You need to give the conversation your undivided attention and actively listen and acknowledge what the individual is saying. Recognize that what is not said also speaks loudly. Utilize open-ended questions. Open-ended questions allow for the inclusion of more information, including feelings, attitudes, and understanding of the subject matter. This allows the coach to better access the learner or the client's true thoughts and feelings on the topic. Lastly, use a non-judgmental approach when coaching. This means suspending judgment, letting go of maybe my solution is the best habit, which many of us have, and instead encouraging the other person to offer possible solutions to this situation. And now Dawn is going to walk us through the principles of the NLN Guide for Teaching Thinking, which can be used to facilitate the coaching process.
So one of the tools that nurse educators and nurse mentors can utilize to facilitate coaching with students or novice nurses is the NLN Guide for Teaching Thinking. So this guide was in as a response to the call to action for nurse educators outlined in the NLL vision statement, debriefing across the curriculum. The three concepts that are outlined in this NLN Guide for Teaching Thinking are content, context, content, and course. This guide provides a structure that educators can use in conversations to guide students to discern what is meaningful and relevant and use their knowledge to work through the problems of nursing practice.
The model we use to frame coaching conversations begins with a brief. Help the learner or novice nurse know that it's a conversation. This gives them a chance to agree to the discussion and understand what will be discussed. The next step is for the coach to specifically state what they saw or what they heard. These statements should avoid labeling or judging the actions that were seen or heard. This should be an objective opinion. The next step is, I think. The coach wants to be sure to share their thinking about the situation as an experienced nurse and the rationale behind the concern. And finally, the coach presents an I wonder statement. This should be an open-ended question allowing the learner or nurse to explain their thinking behind their actions. Avoid asking multiple questions at the end. Let's look at the interaction in which the nurse wishes to discuss the nursing assistant's behavior again. Then practice by looking at a few responses, and you can decide which might be the best response using the coaching conversations model.
I'm Carol. I see that Mr. Farrell's in a wheelchair and the transporter is taking him down to his chest x-ray. I thought I asked you to check his blood pressure and let me know, but I haven't heard back from you. What was his BP?
Oh, right. Well, I went into his room and he was up, walking around and feeling fine, so I'm sure his BP is okay. I just let the transporter take him, nothing to worry about.
Let's apply the principles of the model to discuss a different way for the nurse to have this conversation with the nursing assistant. Select the best brief statement. Just wait for a second for the poll to populate, and we'll see the results. Okay, thank you for your ideas. The best answer is, can we talk for a minute or two about what happened after I asked you to take the patient's blood pressure? Give the student or novice a chance to agree to talk for a minute or two about the topic at hand. The first two choices do not give the learner the chance to agree to the conversation or understand what will be discussed. The brief is more than just feedback or discipline. We want them to be ready for the conversation. And the last choice wouldn't be using the model to begin the conversation. Next. Select the best I saw, I heard statement. Okay, there are the results. Thank you for your responses. The best choice would be, I heard you say that you didn't take the patient's blood pressure because you thought he was fine. When there's an objective statement, the learner is less likely to become defensive and challenge the label or judgment of the action they did or did not do. This allows the coach to be clear which action they're wanting the learner or novice to better understand. Stay transparent in the actions that have made you curious. In the first choice, the response begins with an objective behavior, but then uses a subjective description of the actions. And the third and fourth choices don't contain an objective statement. Let's go on to the next question. Select the best I think statement. Okay, thanks again. You're right. The best answer is the first. I'm concerned that you chose not to follow through on the tasks I asked you to. Taking the patient's blood pressure is an important safety measure for a person who's at fall risk. The coach should not try to reveal to the learner or nurse why that action concerns them. The coach should not offer a rationale for why they think the novice did or did not do what they did. This runs the risk of having the learner agree and not actually reveal their true thinking. The second and the third responses are assumptions. The coach assumes to know what the learner or novice was thinking or what was behind the action that took place. And the last response doesn't contain an I think statement. Let's go on to the next one. Select the best I wonder statement. Good job. The best answer is, I'm curious about your decision to not assess the patient's blood pressure. The coach should uncover the novice's thinking behind the situation. The coach should hear the learner's underlying assumptions and knowledge first. The first response is not an open-ended question to uncover the thinking behind the error. And the second response goes directly into how to solve the problem. The third response is better, but there's more than one question. This can be confusing, and often the recipient will only answer the last question. Okay, next slide.
So now we are going to look at two different videos representing examples of a poor and a better way to coach. Just as a reminder, we're going to use the first scenario that we showed you at the beginning, where the nurse and Carol, the tech, were acting. So in the following two videos, Sabrina and myself are going to represent the nurse and the tech. Sabrina is representing the tech named Carol, and I am representing the nurse. As you listen to the first clip, see if you can hear each of the teaching thinking techniques being used. Carol, I need to talk to you. Come over here. You are not the nurse, and when I tell you to do something, I expect you to do it. What were you thinking?
I'm not stupid. I know what I'm doing. He'll be fine.
He may not be fine, and it will be all your fault. So this is an example of a poor coaching response. The nurse is demonstrating a judgmental and harsh response in tone. Notice that the nurse did not use all of the teaching thinking techniques. Although she did use an open-ended question, it was not inviting, and it does not share an opportunity for the tech, Carol, to respond back. And so the conversation essentially ends without resolution. So let's look at a second interaction between the nurse and Carol. And again, listen to hear if you, to evaluate if you hear each of the techniques being used. Carol, can we talk about what happened with Mr. Farrell? Earlier, we talked about the need to check his blood pressure before he went down to X-ray because of his fall risk and feeling dizzy.
Yes, of course.
I saw Mr. Farrell head down to X-ray, and I noticed his blood pressure wasn't documented in the chart before he left the floor. I think it's important that we follow fall risk precautions for all of our patients. And I'm concerned that he was not assessed before he went down.
Well, when I went into his room, he was walking around, and he said that he was feeling fine. I know you asked me to check his blood pressure, but since he was feeling okay, I thought he likely was okay.
I appreciate you sharing what you were thinking. I wonder if you could review with me your understanding of fall risk precautions and why you thought Mr. Farrell wasn't at risk this particular time. So in this example, all of the techniques were utilized by the nurse. She first alerts Carol to what she would like to talk about. She utilizes a clear I saw statement about the missing vital signs without integrating judgment into that statement. She utilizes a clear I think statement, which follows the nurse sharing her concern as the experienced nurse. This judgmental observation then allows for Carol to share back her own understanding of the experience. And then that further allows the nurse to better understand what Carol's thinking. The dialogue then continues with an open-ended question to get Carol to further reflect on fall precautions.
Okay. So let's go over the takeaways from this webinar. At the beginning of the presentation, we listed the objectives that would be met during this webinar. You were given 3 definitions by 3 different people, all of which stressed being able to maximize, develop, or improve one's performance via teaching or instruction. And then you were given some of the important benefits gained from coaching. These are to improve teamwork, patient care, team peer relationships, or to produce empowered novice nurses. We then identified the key concepts involved in coaching responses, as well as introduced you to one of the tools that nurse educators and nurse mentors can utilize to facilitate coaching with students or novice nurses, the NLN Guide for Teaching Thinking. Next, you viewed a video dealing with a situation that requires coaching, and via poll, you were given the opportunity to practice the information learned in this webinar to provide appropriate coaching responses related to the video you viewed. And finally, you viewed samples of not so well and well done responses to the video you coached, and you were explained on these videos why these responses were appropriate. It's time now. It's the end of the webinar, and we would like for anybody who has any questions to submit the questions in the chat, and we will answer them, as many as we can.
So one of the questions is, where can we get a copy of the NLN Guide for Teaching Thinking? The NLN, I believe, store has it. They have a little, and also Amazon. You can find it on Amazon too. So another question, I'm wondering how coaching can be used. Oh, I just lost it. Wait a minute, sorry. I'm wondering how coaching can be used in the classroom in addition to clinical or lab. Somebody from the panel want to answer that?
I can speak to how we have used that in the past, and that a lot of times in our classroom situations, we try to interject things that are just like this really short 27-second video clip that we put in today. And then we emulate that in terms of, you know, what would you say, what would you do? I think that it's very helpful both in helping pre-licensure students to learn about their role as a team member. And it's really helpful also as we're working with students as they progress more into their leadership role. How do they work in terms of being in charge of a team or being in charge of certain individuals on their team? So we just use it in an exemplary manner. And I think that's the coolest thing about it, is that it's just such simple tools to be able to apply to almost any kind of a situation. Yeah, and others please chime in, but I know that's how we've done it. It's just kind of integrated into our actual presentation in lab or virtually now, being a virtual discussion.
And what we're trying to do in education is to help people think critically. So if the conversation it goes only to this is how to solve the problem, you don't stimulate that critical thinking. So as Teresa said, this can be used in any conversation that you have, and should lead to a more in-depth critical thinker as a nurse.
And I'll just add, as people get comfortable using these techniques and you repeat the same words, that then you can engage in more difficult conversations. And I think that's really important, because when the person using those words and the person hearing those words knows kind of the routine, it's less, again, less judgmental and more of a let's talk about and reflect rather than criticism.
Yeah, that's a really good point. I think it just, for myself, it just became just kind of the algorithm that I applied to conversations, and that I tried to translate that to all all, because I work with a lot of different healthcare disciplines, to all the disciplines that we work with to improve their communication, and then to really help them and mentor them in their educational process. Because otherwise I just become reactionary, as in the negative video clip we showed today, that you make a judgment, you tell them what they did wrong, and the conversation ends and nothing changes, you know, kind of thing. They still don't really understand, and you know, it sometimes landed in leaving relationships damaged. And I think there's so much literature out there that talks about, you know, nurses in that first year becoming overwhelmed and burned out. And if we're not able to have conversations that help them move along and become empowered, and that we know what they're thinking so that we can help support them, then we're only contributing to those very high numbers of people actually leaving the workforce before they ever get started. And so just something to think of.
Sorry, I saw several commented that they were using these techniques in their sim lab. And so many of us who are presenting work in simulation. And so we would agree that these are absolutely techniques you can use for debriefing a simulation. And someone else asked if there were similar videos for the graduate nurse practitioner student. And I would say, again, these techniques cross all environments. You can even use them with your kids or your spouse. Really, it's, as many of us probably do, because we've learned these techniques. So it really crosses all different levels.
So one of the main points is to be curious. So instead of making a judgment, putting a label, be curious.
So another question from Ruth are, what are your thoughts about how the coach's emotional intelligence affects their ability to follow this coaching approach?
I think we're all pondering the question. I'm not quite sure how to respond. I guess I will just be transparent and say I'm not sure exactly how emotional intelligence is being defined in the context of this question. I think I mentioned earlier that for me, it just became a technique that I developed, and it became more of a habit, and therefore a skill set that I use, just like so many skill sets that we develop as nurses. And so I guess that's how I'm answering there, that it just became part of my normal intelligence and process in conversations.
And I think for some people, using the strategy of giving an objective, I saw or I heard, helps to break it down to the point where it starts the conversation with a person. And so even if you're worried about emotional intelligence, if you start with something objective, that helps to get to the issue and helps to uncover the thinking. And that's part of the beauty of this model, is that you're hearing the person go through their own mind and think about the background and think about their thinking, which is a higher order concept. And hopefully that leads to long-term higher order thinking and higher emotional intelligence.
Yeah, it's definitely seeing it from someone else's lens. I think that so often we just see it from our lens and we react in that way. And when you reframe it and you ask these questions in the way that we've kind of talked about today, it allows you to see the lens of the other person and know what were the incentives or the thoughts that caused those actions versus my assumption of why they did those things. And I think that's really the crux to it, is just being so curious and keeping it in that stance of curiosity to be able to move it in a more positive manner so that, you know, it's respectful, you're mentoring, you're truly curious about what was going on here.
Another question from Samantha. Is it possible to receive, oh, I'm sorry, wrong one. If you find that you're having the same issue with the same students, should you use this method over and over again? Yeah.
I think
Like
that's
hitting them over the head, right? I think you have to keep using these techniques, and at some point you would hope that they get it. I think another way is to use examples, and so it might be easier for that particular challenging student to either see themselves, so you could record that and then have them reflect upon what they saw, or utilize other examples to show them.
Mm-hmm.
Lori asks, I am teaching virtually 130 students. How would you suggest I integrate? I agree with your initial comment about lecture.
So Lori, I think we know each other, but I would say you can do this in a synchronous session where you could utilize, just as we did, you could utilize quiz questions, respondent questions. Mm-hmm. And so you could use, if you have pre-recorded simulations, for example, from your lab, you could use a pre-recorded simulation. You could stop the scenario and ask the class questions, just as we did here. You know, I think that would work pretty well in that large group. You could also break them into subgroups, and they could do some role play within smaller groups.
Yeah, that's definitely more of a flipped methodology is what we've been trying to do recently, and in the same way that you're using the same conversational tools, but it is done in a virtual way. And sometimes it sounds like you have a pretty large number, like Jenny said, maybe putting them within cohorts is also helpful.
I find the technique helpful when you get a response from a student that is totally opposite the correct response or your opinion. And instead of saying, what were you thinking? if you say it in terms of, I'm curious, can you tell me about what you were thinking? It gives me time to think and kind of process what was just said, and then makes the student break down their process, and I think it helps to make it into a conversation. And again, as several of us have said, it's the be curious.
Mm-hmm.
So Monica asks, in the clinical environment with students, how can we continue to encourage them to participate positively if they aren't effectively applying theory to patient care application?
I think in a kind of just an example way, I think it would be, as you went through the process, it would be your phrasing that in your conversation in terms of, you know, this is what I heard. I'm thinking that, you know, I would be, as a nurse, I would go back to the theories I've learned, blah, blah, you know, and then just bringing that into that in terms of solidifying in your questioning of their thinking. You know, I'm thinking this goes back to the theory of, you know, the patho for DKA, but, you know, and I'm curious, you know, was that part of your thinking when you came up with this answer? So I think there's ways to still do it. That was probably not very eloquent because I was trying to think of an example as I was talking, but I think it definitely can be done.
And I think one way that we can use it is to, just as Teresa said, you can, you know, as we talked about in class, whatever theory, and then you can point out the gap. So this is what you learned in this class. However, I saw you do this. Can you tell me, can you tell me what you were thinking? But it helps to identify the gap, and then you can tie it back to what the theory is.
Mm-hmm. I think my experience about that, it brings to mind a couple of times when I've actually framed it in that way. And quite honestly, students had so many different things they were processing. When they told me how they were thinking, it actually clued me in that they would hear something in one class and something from another instructor, and it was conflicting, and that was actually the frames that they were working on. So it can be very kind of just enlightening, and especially the more novice the person, I think it definitely is.
We have a few more questions. What are 3 key pieces of advice you can give me as a new preceptor of 4th year nursing student? I am an RN with 15 years of bedside experience, yet no preceptor experience.
Take a deep breath, be non-judgmental, and be curious.
Be curious, yes. I think that's the key to it. And yeah, just, be supportive and be curious. I think that's truly it. Because it can be very frustrating, and especially the world as it is now is such a stressful healthcare environment. But I think that your resilience and being able to pull upon things such as this can actually give you tools to make your role for these 4 mentees definitely easier for you, and hopefully encouraging that they see your value in moving this and structuring it in a way to be supportive of them.
I would like to point out that if you look at the slide that's up right now, it sounds like a lot of the questions are related to people wanting to know specifics for what situations you could use this information and how you can apply it to some very specific incidents or situations you're having. And I do want to point out to you that the National League for Nursing has an e-learning course on coaching called Coaching for Excellence. In the course, there's going to be a lot of background information and also opportunities for practice. The course earns 5 CEUs. It's very immersive. It has 5 content areas or 5 different modules related to coaching. Each module takes about 10 to 20 minutes to review content, but also it's followed by an interactive challenge. So you will see videos similar to the one that we showed you today. And then you have an opportunity to record yourself making a response to the novice nurse in the video. And I think that you will find that is very different from answering multiple choice questions. Just like, when you give a multiple choice exam, people have a really good chance of getting the answer right, even if they're not totally knowledgeable about the answers. But when you're doing a video of yourself, you kind of are on the spot to really put in words the, I think I saw, I wonder. And it's a really helpful way for you to practice. There's 6 different opportunities for you to see a situation and make a video. And after you do the videos, you submit them into the course. You do a self-assessment on your video. You get peer reviews from others on your video. And you also, each of your responses is reviewed and scored by an expert NLN educator. And these are just some of the things from the course, but Andrea, if you move on to the next slide, I can just show you how to get into the course. As you can see, you're probably all familiar with the NLN site at this point, and so you may know this, but if you're trying to find something, the quick links is the best place to go to find anything, and there's a link right to Coaching for Excellence. What you'll see when you look there is that the course, once you register, it's open for, well, there's a new course every 10 weeks. So the next one is actually starting on Monday, October 5th, and you can register anytime. The course, once you register, is open to you for 10 weeks. And just keeping in mind that each module takes about 20 minutes, and then whatever time you need to create your own video, you know, we'll obviously add to that 20 minutes. And then you, within a few days, you'll get a response and some feedback from the coaching expert. So once you have the course, again, you can enter it as many times as you want within that 10 weeks. So just please, if you're interested, take a look at the quick links and go to the Coaching for Excellence course, because there'll be quite a few more details there. And again, a lot of ways for you to specifically practice and to see how these techniques could be used in coaching conversations. I just wanted to be sure that we mentioned that, and I know there are still some questions, so I am going to turn this back to Dawn so you can continue with the questions. Thank you.
I think, let me see. I think that basically we covered the majority of the questions in here.
Okay.
Here, I have one, here, sorry, I have one more. I was taught to use the phrase, help me understand. Would this be another way to be curious and get the person to open up about what they're thinking?
Yes. Absolutely.
Yeah. Yeah, I think that about does it with our questions here.
All right, if there's no questions about the course, we'll go on to our references. And I want to thank all of our presenters for the webinar today. I want to thank Andrea for her expert assistance, as usual. And also thanks to all the participants for your attendance, your attention to the content, and to your commitment to teaching the next generation of nurses. If you'd like any more details and practice, we will see you in the course. Thank you.